PI3 kinase pathway is a oncogenic pathway, frequently activated in a variety of cancers, including lymphomas, but it's also activated in lung cancer, breast cancer, and other malignancies. So it's a dominant oncogenic pathway, and that's why people are interested in targeting in multiple types of cancers, and including lymphoid malignancies. It's a complicated pathway because at the top of the pathway there are multiple PI3 kinase isoforms. Any of them can activate downstream events in this pathway, and frequently multiple isoforms can work together in activating the pathway. So if you inhibit one, the other one may compensate for it and so forth. But in general, it's a pathway that is a oncogenic, and if you inhibit this pathway, you can induce either cell cycle arrest, meaning you inhibit proliferation, or cell death.
Idelalisib is the first PI3 kinase inhibitor to be approved by the FDA for hematologic malignancies. And it was approved on the basis of a study published by Dr. Gopal, a single-arm study, where the response rate was around 60%, with a few complete remissions, and the median progression-free survival was around 11 to 12 months. So this pill, which you take twice a day, induced responses in a majority of patients, and these were clinically meaningful. And as a result, the drug was approved and has been used in the treatment of follicular and low-grade lymphomas, as well as CLL.
The first PI3 kinase inhibitor approved by the FDA is idelalisib, which is an oral PI3 kinase delta selective inhibitor, approved for both CLL and follicular lymphoma. And at least in follicular lymphoma, the response rate, as I mentioned, is about 54–55%. Pretty good, especially in patients who failed 2 prior regimens. So it's good response rate, lasts for about a year or so. As I mentioned, just because they are not chemotherapy-based targeted therapy doesn't mean that they don't have side effects. They do have side effects that's unique for these class of agents. In general, PI3 kinase delta inhibitor, idelalisib, is relatively safe, but there are approximately 10% or so side effects that will lead to dose interruption or reductions. Mainly what we worry about are the colitis, hepatitis, and pneumonitis. So like mainly probably autoimmune mediated. So you can have lung infiltrate that is not infectious, that requires dose interruption, maybe steroids. Colitis, you have frequent diarrhea. And then the hepatitis or transaminitis, you have elevation of liver function enzymes that require dose interruption and reductions. Colitis is very difficult to predict, but patients with autoimmune disease, especially with, like, say, celiac and Crohn's disease, you would want to avoid this also on these patients.